Okay, Caroline, thank you very much for joining us today. I know it's hectic just now and you've got the weight of the world on your shoulders a little bit, but we really appreciate you taking this time. For those people who don't know, what we did was last week we asked through the staff brief for people to submit questions. Now, the original idea from yourself, Caroline, was that we maybe did a Facebook Live, but we came to the conclusion that maybe didn't work for all staff who perhaps don't have access, those who can't access Facebook on work computers, etc. So we decided to do it this way, but we're more than happy to hear people's feedback about how this goes, about what platforms we use in the future. But I think you felt that the important thing was that you answered these questions and we made a step towards answering them. So thanks very much for that. I would also like to say that for people watching's benefit, Caroline hasn't seen any of the questions in advance, so she will be answering them as live. I won't be censoring the questions. I've tried to make an honest representation of them. There's a few where we've had a few on the same topic, so I've rolled them up into a single question, and they're a bit paraphrased, but they are as hard as you've written them, and we'll see how we get on with that. The only other thing I was going to ask, Caroline, do you want to talk a little bit before we start with the questions about what it is that you're trying to achieve with sessions like today?
Yeah, thanks, Mike. And I'm actually looking forward to the next wee while and answering the questions. I'm just trying to make sure that firstly people know who I am, and hopefully convey that no question is a daft question. And actually also that as the chief exec, I don't have all the answers. I rely on a very skilled team, and that's huge, to make sure that they keep me safe and that we do the best things that we can across Grampian. So today I would much prefer to be in a room with people, Mike. I think most people would know that about me. And I do that regularly with teams, but the reach of that is really small, and just now it feels like I need to be able to be more accessible to everyone. So I thought doing something like this, you've explained why we're not doing Facebook Live. People might have a preference for me to do that as well, I don't know. But the intention is just to hear the questions, to answer them as honestly as I can, and to try and generate a bit more of a dialogue with colleagues, as opposed to the communication that tends to come out, which is a bit more of a informing. I am, as many people know, love to have conversations. So that's the intention, and hopefully at some point in the near future we'll be able to do this face to face. But let's see.
Yeah, fingers crossed. Okay, well, I'll just get straight into it then. One thing we haven't done, and we didn't ask people's permission to put their name out there alongside their questions. So we'll address that the next time we ask for questions from people. But at the moment, I've left them all anonymous. Okay, so the first question comes from someone who is asking about FFP2 and FFP3 masks. They've basically highlighted the fact that Omicron spreads much more easily than previous variants, and they've asked if we would consider introducing FFP2 or FFP3 masks across NHS Grampian to help deal with that. They've also highlighted a recent recommendation from the BMA for FFP3 masks, and also a study at Addenbrooks Hospital.
Thanks, Mike. So I think, yeah, would we consider any suggestions to try and make sure that we ensure that our colleagues feel safe at work? Absolutely. And I think that throughout the pandemic, the advice that we have taken as an organisation has pretty much followed the national guidance. So if delighted to see any evidence now, it wouldn't be me that would look at that, it would be our experts around that. So June Brown, who's our Executive Nurse Director, Susan Webb, who's our Director of Public Health, they both have teams. I'm sure they are known to lots of people in public health and infection prevention and control, who work together really closely to understand the evidence and what the pros and cons are to this stuff. but if there's new evidence that's emerging, absolutely, let's have a look at it. And I will get June and or Susan to explain the rationale for why we would not go forward with that. Don't know the specific answer to the new evidence, haven't actually seen it, but agree that the Omicron variant is definitely more transmissible, and we need to do everything we can do to support staff. So if we can get copy of the research article, that'd be great. Although I'm sure our colleagues perhaps have already looked at it, but we can look at it and pop something back in the staff brief perhaps around what it is, or indeed I can get somebody to reach out to you if we've got your name and details to explain where we're at with it.
Yeah, we have got the gentleman's details, so I can pass that on, and we can share the studies with you as well. Okay, thank you, Caroline. The next question is a hot topic across the system, as it always is, but particularly just now, and that's in relation to bed shortages, particularly over the medium and long term. The member of staff has mentioned obviously the new surge wards coming on stream, but acknowledges that they are likely to be a limited short-term step. I just wondered if you could talk to us a little bit about that.
Yeah, I mean, bed shortages aren't a new thing, are they? So, and it's a really difficult one actually, because we just never seem to have enough. But actually, the rate limiting factor for us is about making sure we've got the right workforce to care for patients if we put them in those beds. So actually, opening up additional beds per se is not really an issue. We've got beds, we've got all the kit that we need to put around that. But one of the things that I hear loud and clear is that there's no point in opening beds if we're not able to staff them. And of course that is true. So recognise just now in particular, in fact, every winter we have this dilemma, but just now there is a real concern around it. And so just now, so January, February, March, we're going to have the same pressure that we have every year, if not more, around managing a balance between patients that need beds and the staff that we have. And that's just something that we have to negotiate through. But actually, the point that the colleagues that raised this is making around it being interim, it's not ideal for anybody. And one of the things that I'm really keen that we do coming out of this is to actually look at what is the bed base that our population data tells us that we need, and how do we design our system to have the right workforce to manage that. That's not going to be a quick fix. That'll take us several years to get there. But I think setting out as we come out of the immediate part of this pandemic, to actually say we need to try and do this in a more sustainable way, not just in health, but across health and care, because all of you will recognise that interdependencies across our health and care system. We need to do this more sustainably, so they're not having to pop up surge beds or do things that actually mean staff don't know what the bed base is that they're going to have to be managing when they come into work that day. So yeah, I think the interim kind of popping up and down of beds is just not satisfying for anybody. We are where we are with it just now, and we're definitely going to have to continue in that vein this winter, unfortunately, but really keen that going forward we manage to change that to reflect what we can do.
Okay, so the next question also refers to surge wards and staffing. The person who submitted the question, I think, is very, very frustrated that they've been involved in the recruitment of a lot of extra healthcare support workers to the bank over the last couple of years. And I think where the frustration came from was they felt, why wasn't the bank staff the first place we went to ask for volunteers for the surge wards, rather than ask what is an already stretched and exhausted workforce?
Yeah, so I'll start off by saying I share your frustration. I think one of the things that I've thought really hard about is how can we possibly ask colleagues who've been at this for 2 years to do more. As Mike said, I haven't seen these questions before, but it is my recollection that we did approach the bank. We did put a request out to the bank. and I think that was about interim contracts actually, but the reason the email went out to ask staff to volunteer was because of the concerns that we are going to face a high number of staff absences because of Omicron, and potentially a increased demand from patients because of Omicron. So the number of staff required is going to be more than we would usually have to look for supplementary staffing in the winter. So the reason we put out an email to ask people to volunteer was with the right intent, which is, I think, to ask people to volunteer, because the next step after exhausting the bank, agencies, other supplementary supplies, asking people to volunteer, the next stage is to deploy people out of their current roles into other roles. And I know how difficult that is. So recognising that we'll still probably have to go there to some degree, the intention was to give people the choice and ask them to volunteer first. However, absolutely share your frustration. The number of new recruits has been phenomenal over the past year, and particularly the work around healthcare support workers and the educational support that's gone into that. I hear regularly from Jane Ewan in regards to how well that's gone. So yeah, recognise your frustration, feel it too, and want to acknowledge just how much effort it takes to get people onboarded and into post. And I know that's been a lot of work for colleagues over the past year.
Yeah, absolutely. The next question is, again, quite similar. There's quite a few questions here on workforce and the pressures that we're feeling just now. The colleague basically, as you said a minute ago, actually talks about the relentless pressure we've felt over the last 2 years and how it feels never ending. To quote their question directly, they've said that it feels like they're being asked to do more, work longer, and work harder without an end in sight. They also feel as though they are saving patients through their hard work and through their colleagues' dedication, but they're really worried about the cost of that on their own and their colleagues' well-being. And they wanted to ask, what are we doing to get people the help they need? And can you offer any reassurance or hope for the future that we might be able to end this constant cycle?
Yeah, gosh, quite a lot in that, Mike. So I agree, actually. I think that this has been difficult for everybody. So on a personal level, for everyone, this has been really difficult. But on a professional and, I suppose, business level, health and social care in particular have been significantly the demand has been huge. It hasn't stopped. I think it's varied, if I'm honest. I don't think all teams have been under the same amount of enduring pressure throughout the 2 years that we're now going into. But it would be fair to say that pretty consistently, colleagues working in health and care have had a really tough gig over the past 2 years, and I include everybody in that. So I too am concerned. I'm concerned about the impact this will have short, medium and long term on colleagues. I'm concerned about the longer term, I'm concerned about the short, medium and long term impact on patients and their families. And I absolutely agree. I believe that you're not only saving lives, but you're making lives tolerable for people who are waiting for things, irrespective of what it is they're waiting for. They're waiting longer, for people who are isolated, for people that need additional support, and haven't had the family infrastructure around them to do that. So not only are you saving lives, you're making life tolerable, and that of course has an impact on everyone. Can I give any guarantees that it's going to get any easier? Not in the immediate future. So definitely not in the next few weeks. And I am asking that you stick with us in the way that you have done, for certainly for the rest of January, February, March. Then do I believe we are going to have to take ourselves to a different place and manage this as part of a normal way of delivering health and care? Yes, I do. Do I know what that looks like just now? No. I'm not sure anybody does, but what I absolutely recognise is that we can't continue to fluctuate in the way that we are doing from a public perspective or from a workforce perspective. So, yep, I hear you loud and clear. I agree and feel the same concerns. And I think we have a particularly tough time, January, February, March ahead of us. And then we will have to find a way together of how we're going to live with this in a different way. That's not just us, that's everybody globally, which is quite an unusual thing to say. But I definitely hope that that is what we see in 2022.
One of the, I don't want to call it a positive out of the pandemic because it just doesn't feel right to talk about things that way. But one of the things that might be worth highlighting just now is that the array of staff support that's been put in place through the Resilience Hub and various other bits and pieces. Do you want to just talk a little bit about that?
Yeah, so I do. So I hope most people will have heard of We Care, but I'm not going to stand here and say that's sorted all the problems. So you're right, Mike, and we have a number of things through the We Care website that people can access. However, part of the feedback that I get is that that's fine if you have time to access it. And, you know, our workforce is so diverse, from joiners to surgeons to IT to managers. It's so diverse. People need different things, don't they, to stay well. So we've got the We Care programme, we've got the website, and we have numerous things that people can access if that's for them. I think the biggest thing that I hear is just a little bit of, could we just get a little bit of time as a team? Could we just get a little bit of respite? Trying to achieve that has been really difficult, but working on it. But there are some other simple things that I'm looking with colleagues to look at. So over the festive period on Twitter, I don't know if any of you saw it, a colleague tagged me to say that no access or reduced access or no access, I'm still trying to find out, to hot food and drink and coffee on the public holidays and out of hours. So Paul Allen, our Director of Facilities and Estates, I know has been working on that for some time, and I've discussed it with Tom Powers, our Director of People and Culture, to say we need to get on top of that together. So stuff like that just feels really basic, which is probably where we are just now, is work that we're trying to do. So trying to make the little rest time that people do get at work, allowing them to access just stuff that we would expect, such as food and fluid. But on top of that, still trying to encourage people to take leave, which I know is really difficult. And I know if your colleagues phone you to say, can you do an extra shift? It absolutely feels like the thing you should do. And if you feel able to, that's fine. But if you don't, you need to find the strength to say you can't, and you will be supported with that.
Okay, thank you, Caroline. Following on from that, the next colleague has asked how concerned you are coming out of the pandemic, and I suppose it was an issue even before the pandemic, but how concerned are you about staff retention and recruitment? They've also asked what's being done to address that, whereabout it is on our list of priorities, and I guess very importantly, when do we expect to see results of any work that's ongoing bear fruit on the front line?
Yeah, so how concerned am I about retention and recruitment? Significantly. Probably about 3 months into being a chief exec, having been the nurse director here before, I was able to set out some kind of strategic priorities, and one of those was to put the workforce centre stage. I genuinely believe that if we treat our colleagues with the respect and the opportunity to engage and shape the system that they work in, then the level of morale and enthusiasm will improve. And I don't just believe that, there is an evidence base behind that. And so Am I worried about it? Yes. Is it one of our highest priorities as chief exec? Yes. As an executive team? Yes. And there are multiple things that we were looking at before COVID to attract and retain staff. The things that, and again, back to that conversation about different communities of our workforce need different things. So things like the things that spring to mind immediately are for our nursing colleagues, the programme of Magnet, which is all about recruiting and retaining staff. The opportunity for colleagues to engage in education, irrespective of what they do, pipelines from colleges, from schools, etc., international recruitment. I could go on, I'm not going to, about the range of things that have been undertaken pre-COVID. Some of them have been maintained during COVID. Some of the principles have been held on to. And I think that's the key thing just now is I believe the thing that attracts and retains people is coming to work, feeling valued and working in a culture that actually allows you to feel that you are contributing and that you are recognised for your contribution and you feel part of a team. So the cultural piece for us, which is fundamentally just about how people treat each other, has remained a really core part of everything throughout the pandemic as well. So when we move out of this winter, so moving into April 2022, we are going to need to, again, I spoke earlier about looking at what is the bed base that we need, but actually we also need to look at what is the workforce that we need and help teams really at a local level to shape that by themselves, because I think continuing to advertise and try to recruit posts that we know just don't exist is not the way to do it. How are we going to make ourselves as attractive as possible to recruit, but also make sure that we stay focused on the colleagues that we have in the system just now are brilliant. So how do we keep them and not lose them, and make work something that they feel is enjoyable to come to, and then also the other programmes of and ideas that people put forward around recruitment, really making that happen. But the reality of us kind of moving into that is not going to be until spring, summer. But there was a ton of stuff ongoing before the pandemic, and a lot of that has continued.
Okay, thank you, Caroline. And then we'll come to our penultimate question. This is one of those that's slightly more technical, I suppose, that you may or may not know the answer to. This is again from another healthcare support worker. He mentions that he doesn't think NHS Grampian currently sponsor potential healthcare support workers under the Health and Care Visa Scheme, which allows medical staff to come to the UK. He's asked if that's correct and if we're considering changing that to help alleviate shortages in the future.
Okay, so I'm not going to pretend to be a technical expert at all on our visa, the visa rules, which change, and the last close contact I had around this was actually when I was trying to understand it. When we were recruiting colleagues from Australia. However, we have an expert in Sarah Dalgarno from the workforce team who is absolutely on the pulse of visas. And if there is anything that we can be doing to enhance our recruitment, then from a visa perspective, Sarah will know the answer to that. So it's not my understanding that we have any restrictions around other than the restrictions that are there in the legislation around visas. But I can certainly ask Sarah and we can put a specific answer to this question, I think, in the brief. That would be helpful. Healthcare support worker workforce for me is an incredibly interesting one. And actually with our level of vacancies, the question I ask myself, the question I discuss with my colleagues a lot is, what is it that would make a healthcare support worker role attractive? And the feedback I get when I speak to you and your colleagues is to have a career pathway, to have education, and again, to feel valued as part of that team. of which you are clearly a critical part. So whilst the visa aspect, I need to get you the technical answer to it, and I'm not aware that we have recruited internationally any healthcare support workers, but I could be wrong on that. The question that I challenge my colleagues with is, why is it not attractive for our local citizens to want to come and work in these posts? And that's something that I think you and your colleagues, particularly our healthcare support workers that are now delivering education, have spoken to me about around the things that make a difference to your community and our workforce. So I think, yeah, the visa thing, I'll get you a technical answer to it, and if we can, we will. But the bigger question for me is, how do we make the role attractive for citizens of Grampian to come and work in those roles, because they are critical to delivering health and care.
Absolutely, the system just falls to bits without those roles. This is the final question, which is a slightly more, well, I wouldn't say a personal question, but it's about you specifically rather than the system. This is from someone who would like to, and it's a valid point, especially at the moment. They would like to know how you manage to decompress, how you manage to relax at the moment, given the pressure you must be under. And they've also asked how many hours of sleep you're managing to get at the moment.
Yeah, so of course I could say an answer that you might think I would say, but actually I think it's quite hard. How do I decompress just now? And I don't think I'm alone in this. Like many of my colleagues, my days are long, and I think, Mike, you opened this by saying, and you and I speak, so you opened this by saying, I feel as if I have the weight of the world on my shoulders. Sometimes I do feel as if that is how it is. So it is difficult to decompress. So I am ever an optimist. So I try to reflect on what's going well. And I try to reframe things in my head that I'm worried about. I have huge confidence in my team and how they provide leadership and support. And also, I've worked across Scotland. I think some of you have heard me say that before. The resilience and the loyalty and the level of care, doesn't matter what job people do, across our system, astounds me every day, and that's what I hold on to. I know we all have bad days, and that's okay, but predominantly when I'm out and about, when I'm observing things, and people don't know I'm just observing, I see really kind and caring interactions between staff and between patients, between families. So I hold on to that stuff. But from a personal perspective, I enjoy spending time with my children. I enjoy spending time with my husband, and we have 2 grandchildren who arrived during COVID. And so actually, when asked to babysit, you have no alternative but to be distracted, because a 1-year-old and an 18-month-old baby don't listen to, I've just got to go and take this call. So yeah, that's a great distraction. Regarding the sleep question, Mike, I'm not going to answer that, and you can perhaps tell by the bags under my eyes, not as much as I should, but I am continuing to try different things to work out how I can get a better sleep pattern. But I think getting Omicron out the way might be the answer to that.
Yeah, I think that'll be the case for a lot of us. Oh, well, thank you very much for joining us for this, Caroline. I know it's intensely busy just now, and I know you would much rather be in the room with people, as you've said. There are 1 or 2 questions that we will come back to people directly with answers to, and we will update on in the brief. I'd just like to finish by saying that if people could give their feedback on how they feel this has went, neither Caroline or I, our TV presenters, we just wanted to do this rough and ready, and to put your questions to Caroline. So any feedback at all about how we can do this better for you going forward would be hugely appreciated. And thank you very much for your attention and taking time out to watch this. Thank you.
Thanks, Mike.